Thank you very much, Candice. Today is Saturday, 5th September 2020. Good morning to Minister Young. Good morning to the Chief Medical Officer, ladies and gentlemen of the media, and members of the listening and viewing public. I thank you for tuning in to us and not necessarily the cricket. That's good. We are here once again to account to the nation as to what is happening with the coronavirus epidemic globally, and more importantly, how it touches and concerns us in Trinidad and Tobago. I'll be making 3 points this morning, but to contextualize those points, I must remind the national public that the world is still in what the experts are now saying in the beginning stage of a second wave of coronavirus infections. In the world today, there are now over 26 million cases, 26,861,335. Of those persons, 880,131 have in fact died. What is more concerning to us as policymakers around the world when we speak to each other virtually or whatever is that the daily rate of infections around the world shows little or no sign of slowing down. As a matter of fact, it is creeping up to the 7-day rolling average of August 19th at 300,000 cases per day. That is a quarter of Trinidad and Tobago's population every day being deemed positive. So globally, the pandemic is showing no signs of slowing down. The 3 points that I wanted to make as we battle this coronavirus epidemic in Trinidad and Tobago is this. 1. I want to sincerely congratulate, and kudos must go out to the NCIC for taking the very wise leadership position of not having a physical Diwali Nagar and in fact moving it to a virtual platform. The reason why, in my view, this is so important is that we must not give up the fight of the virus, but find ways to adapt to it. And moving to a virtual platform tells us we can still celebrate who we are as a people, still celebrate our culture, our religion, and still do this in the face of a pandemic. So I want to thank them most sincerely, thank the Hindu community, and thank the NCIC for taking this very, very good leadership position. The second point that I wanted to deal with this morning is the new public health regulations which came into force after the debate in the Parliament. I am happy that the public is talking about masks, because the more we speak about it, the more it sinks into the psyche. However, a downside to the public discussion about masks is that it is only focusing on masks and not what the regulations say. So, I want to go to the regulations to lend some clarity that these regulations are not only about masks, because we have people who are asthmatic, people who are exercising, and I want to bring some clarity to it. In the interpretation section of the regulations, section 2, in these regulations, face covering means a covering of any type which covers the nose, mouth, and chin of the person wearing it. It does not specify a mask. It says a face covering means any type which covers the nose, mouth, or chin. When we go on to sub-regulation 6.1, requirement to wear a face mask, face shield, or face covering when in a vehicle or vessel, it says under 6.1, no person shall, without reasonable excuse, travel in a vehicle or a vessel without wearing a face mask, which is this, covering your nose, your mouth, or chin. or a face shield, which is this. And the importance of this will become clear as I leave on the face shield, because Regulation 7, requirement to wear masks in public, it says, no person shall, without reasonable excuse, be in a public space without wearing a face mask, which is this, a face shield, which is this, or a face covering in a manner which covers his mouth, nose, and chin. I am trying to draw the distinction between this, which some people are objecting to for reasons, may be valid, you may be asthmatic or whatever, but you could wear a face shield. This will allow you to breathe freely and gives you a high degree of protection, not as much as a mask, but some protection is better than none. You can exercise in this, you can be out in public with this. So I hope that clarifies the issue, that it is not a regulation to force you to wear a mask. It is a regulation that guides behavior to cover your face. You have options: a face mask, a face shield, or any other covering. So for the asthmatics, you want to be out in public, wear a face shield if you don't want to wear a face mask. So I'm hoping that that lends some clarity to it. On the Ministry of Health's website, on the advisory on the use of masks, we also have when and where to use a mask, when and where to use a face shield. So I'm hoping that lends some clarity to the issue today. The third issue I would like to raise is one that global policymakers are facing around the world, whereas we now expect that we are going to be treating with this in successive waves. Hopefully each wave becomes smaller than the previous wave. I would have indicated at an earlier press conference that many countries around the world that were initially seen as leaders, like Trinidad and Tobago, are now experiencing this second wave. I want to take you to some research out of the University of Munster in Germany, which is a world-recognized public research center. And the caption of that article goes like this: Germany's virus response won plaudits, as many countries did, New Zealand, Trinidad and Tobago, all around the world. But protests over vaccines and masks show it's a victim of its own success. It may sound familiar. One of the professors, his name is Thorsten Quandt, said this: virologists say there is no glory in prevention. If prevention is successful, people don't see the danger. Sounds familiar. He goes on to say, the irony is the less you can feel it and more successful you are with pandemic measures, the more people say we should stop these measures. And that is what we as policymakers are faced all around the world. As cases start to go down, people think that this threat has dissipated. You may recall, and I am on the record as stating this, when Trinidad and Tobago was placed second, I believe, by the University of Oxford, and I was asked at this forum what I thought about it, and I must get that clip, Candice. My exact words are, we have won nothing. We have won nothing. The virus is still there waiting to pounce or attack. That is basically what I said. So, ladies and gentlemen, as we go through the last week of the 4 weeks of these measures, we must continue these public health measures. The virus is not going away. Pay attention to what Professor Quandt said. Virologists say there is no glory in prevention. If prevention is successful, people don't see the danger. In other words, we think it's gone, we have passed it, we have been successful, let our guard down, become complacent. This is going to be a long-term haul for all of us around the world. And I just urge everyone to follow the public health guidelines. That is, wear a face covering in public, whether it's a mask, a shield, or any other covering. Stay home if you are ill. We are getting too many reports of workers going into the workplace knowing that they are ill and infecting the workplaces. That will capsize the health system. Social distance as far as humanly possible. Wash your hands, sanitizers, whatever. And I think the last measure is clean your hard surfaces. Clean your hard surfaces. Stay home if you are ill. And if we can do these things, the ministry's strategic objective of taking us from community spread back to cluster is something that is within our grasp, but we need all of Trinidad and Tobago to help us. Thank you very much, Candice.
Thank you very much, Minister, for those words of encouragement. Dr. Parasram will now provide today's clinical update.
Hi, good morning, honorable ministers, members of the media, members of the viewing and listening public. Today's COVID-19 update, September 5th, 2020, is as follows. The number of samples submitted to the Caribbean Public Health Agency along with other sites, 24,692. The number of unique patient tests completed thus far, 21,770. The number of repeated tests, 2,922. Number of samples which have tested positive are now at 2,142. Total number of active cases, 1,393. The number of deaths are increased by 1, and condolences go out to that family, 32. Number of discharged individuals are now at 717 with 10 discharges overnight. The number of new cases for this period, 102. Of those, it must be noted that 33 of these individuals out of the 102 have been housed at a quarantine site already and pose no further risk of spread for the virus. They are a group of a cohort of 190 that exists as a police training facility where 2 individuals tested positive last week. We have since quarantined all the persons that have symptoms and tested those. We are in the process of retesting the remaining 150 of those individuals. Once we get the results of those individuals, we will subsequently put them into different groups based on their status, positive or negative, and then decant as need be. In terms of our hospitals, we now have at the Couva Hospital and Multi-Training Facility 75 persons. There are now 5 persons at the ICU. There's a reduction in persons at the HDU going down to 11 now. At the Cora facility, there are 25 persons. And in terms of our step-down facilities, which also houses positive persons that are recovering, we have only persons at the UE Debe campus, 44, and at the UE Freedom Hall, there are the 33 persons that I spoke about previously. At the Napa facility, we have 2 healthcare workers at this point in time. In terms of our quarantine sites, we're at the Home of Football, there are 26 persons, Paria Suites, 95, Regent Star, 25, the Chancellor Hotel, 12, and the Cascadia Hotel, 13. Just to clear up a little issue on when your quarantine period comes to an end, we have been inundated at the ministry, at the CMOH offices, with requests from employers to give us something, a fit for duty in terms of the end of your quarantine period. You are on quarantine because of exposure to a disease. You do not have an illness at that point in time. So we cannot give you a sick leave certificate and we cannot give you a fitness for duty. What we do give from the CMOH office is a letter that says you are quarantined from a date going forward for a period of 14 days or 21 days, as may have been determined by the office of the CMOH. If you have no illness during that period, you have no signs and symptoms, you have not become positive, once your quarantine period ends, you issue the quarantine order, you can give it to your employer, and that should suffice in terms of coming out of your quarantine. If your period is extended, that will be done so by the CMOH, and your new date of quarantine ends based on what the CMOH has put on the form. So that form can be used to exit quarantine. There's no need for a negative test. There's no need for sick leave, and there's no need for fitness for duty. Candice, thank you. That's my clinical update for this morning.
Thank you very much, CMO. And next, the Honorable Stuart Young, Minister of National Security, will address key matters related to Trinidad and Tobago's COVID-19 response.
Thank you very much, Candice, Minister Diyal Singh, CMO, Roshan Parasram. I have come here this morning really to provide an update and to notify persons, particularly those away, of the new liberalized exemption policy. The Honorable Prime Minister, a week ago, last week Saturday, would have announced that he would be meeting with the Minister of National Security after consultation with the Ministry of Health, and we would be devising a more liberal exemption policy to get persons home. I'd just like to remind the population, both here and abroad, that our closure of the borders was one of the most critical pillars of our response to COVID-19, and in particular, protection of the population here in Trinidad and Tobago. We have always wanted all of our nationals who are abroad to get back here and to get back here as quickly as possible. So we're quite happy that we've reached a stage now where, after detailed consultation and consideration with the Ministry of Health, we've come up with the following policy that I'm about to announce that will speed up the process to get our nationals back home. To our nationals back home, we know how difficult it has been. Believe you me, we do know. And we are now moving to another phase where hopefully we will be able to turn persons around a lot quicker and get you back home in the shortest possible time frame. Just to provide some statistics, on the last occasion, I think it was the 29th of July, the Honorable Prime Minister gave the population the statistics as to how many exemptions were granted for persons to come into Trinidad and Tobago. At that stage, the figure stood at 2,250 exemptions granted for persons to return to Trinidad and Tobago. As at yesterday's date, we had granted a further 1,311. So the total number of exemptions granted as at yesterday's date, which I believe was the 4th of September, we have granted 3,563 exemptions. So as at yesterday's date, we've granted 3,563 exemptions to persons to enter Trinidad and Tobago. The following is the exemption policy going forward. We have decided to break countries out into two categories: high risk, medium category, and we deal with persons returning from those countries in a different manner, to persons who are in a low-risk category. These categories would be determined by the Ministry of Health following the categorization by WHO. So WHO have different categorizations of how they treat countries depending on the high-risk and medium-risk cluster spread and community spread. The low-risk category that we are determining is sporadic spread and nil. So those are the two categories going forward. Countries would be put into those two categories, medium and high risk versus low risk, based on the WHO categorization of countries, which can change over time. As we've seen, countries have moved from low risk to medium risk and vice versa. Some from medium and high risk back down to low risk, meaning the sporadic and nil and cluster and community. So with respect to persons returning from low-risk countries, the following will apply. You must not have been in a high or medium-risk country for 14 days prior to arriving in Trinidad and Tobago via a low-risk country. And I'll come to this statistic shortly. We are aware that persons, and understandably, are leaving high-risk countries and going to lower-risk countries. But we will be monitoring, and persons cannot just jump from a high risk to a low risk and that get into how we're treating you in the low risk category. So you must not have been in a high risk or medium risk country for 14 days prior to arriving in Trinidad and Tobago via a low risk country. You must produce, this is for persons in low risk, you must produce a negative PCR COVID-19 test for the 72 hours period before entering Trinidad and Tobago. And 3, once 1 and 2 are fulfilled above, the person who's returning will be required to agree via signing a form, the requisite form, that you can quarantine at home for 14 days in the first instance after arriving in Trinidad and Tobago. So this low-risk category of persons, once you haven't jumped from a high-risk country 14 days prior to come to Trinidad and Tobago, once you produce a negative, well, a COVID-19 negative PCR test within 17 hours, 72 hours of arrival in Trinidad and Tobago, you will sign a form and then you will be allowed to home quarantine for the 14-day period. With respect to persons returning from high to medium risk countries, the following will apply. You will be state quarantined for 7 days upon arrival in Trinidad and Tobago. So this is down from the previous 14 days. You will be swabbed within 24 hours of arriving in Trinidad and Tobago. Once you don't test positive nor present any symptoms of COVID-19 within the 7-day period, you again will be asked to agree to, via signing a form, to then fulfill the rest of your quarantine period at home. And you'll be home quarantined for the next 7 days. Prior to being allowed to home quarantine, you will be swabbed again. So once you've been swabbed the first time on entry, you're not presenting any symptoms, we'll swab you again. You'll fill out a form agreeing to go home and home quarantine for the next 7 days, and you'll continue to be monitored. If, however, you've tested positive for COVID-19 and you do not require hospitalization, it will be up to the CMO and the Ministry of Health to either hospitalize you or allow you to quarantine at home. So the same type of policy that is applying now. So if you have mild symptoms and you're positive when you return from one of these high or medium risk countries, the CMO will take a decision, or his staff will take a decision as to whether you should remain in a step-down or a hospital facility or be allowed to go home and fulfill the rest of your quarantine period via home quarantine. And of course, you'll be swabbed as well. If you require hospitalization, you will be hospitalized. And the CMO may send a person to a step-down facility after the first 7 days for observation, if that is required. We will continue to use the following facilities for state quarantine for this 7-day period. Previously, of course, it was for a 14-day period. Day Bay Campus, the home of football, Paria Hotel, and I'm hoping to get the Cascadia Hotel. We're currently in discussions with the Ministry of Health on that. We will still have the following 2 facilities as state supervised quarantine for those who can afford to now pay for this 7-day quarantine, which would assist because, of course, there's limited room still on the state quarantine side, the Chancellor Hotel and the Regent Star. And along with the Ministry of Health, we continue to look for another facility that we may be able to put into those 2 categories, one of those 2 categories. So this is a new liberalized exemption policy. High risk, medium risk, as determined by WHO and the Ministry of Health. You come in, we swab you, you stay in a state quarantine facility for 7 days, and then decisions are taken. Those coming from low-risk countries who have not come from a high-risk country in the 14 days prior and produce a COVID negative PCR test within 72 hours of arrival in Trinidad and Tobago, you fill out a form and you'll be allowed to go home and home quarantine. We believe that this new policy will allow persons to speed up. Now, I just want to caution persons because we are aware, when I was looking at the numbers this morning of persons who have been returning or persons who are now applying to return from different countries, I just want the population to know. United States, the figure has gone up to 1,702 applications. I should add that in addition to this policy, we will continue to apply the criteria we were applying before the Ministry of National Security. And this really is a focus on bringing home our nationals who live here in Trinidad and Tobago as our first priority. Seeing the figures of applications go up, it is obvious that there are persons who were living abroad, who are Trinidadians, who were living abroad, and now have taken personal decisions that they want to return home. They are not going to be the priority. Our priority is getting back our nationals who were stuck abroad, who had gone abroad before March when we closed our borders, and getting them back safely via this new exemption policy. So in the United States, we have 1,702. This is as at the 30th of August applications. Canada has gone up to 372, whereas initially it was less than 300. The United Kingdom has gone up to 307. And this is the one I wanted to point out. Barbados now is 103. where it was much lower, because persons have left, some from high-risk countries, and gone to Barbados and are looking to jump across. No problem with that once you fall into the exemption here. So if you were in a country, you're in Barbados and you're in a high-risk, medium-risk country, within the 14 days, it's not going to prevent you from coming home, but you will be treated separately. You'll go into the state quarantine facility for the 7 days, as opposed to those who were in low-risk countries before, where you'd go home. And we are asking persons to be honest. We will do what we can to police this via immigration and other records, international travel records, etc. So that is a new policy. This policy will be published, and that is a new policy that we'll be applying in a more liberal approach to get all of our nationals home, because we are concerned to get you home. There's just two other points I'd like to raise. One is the Trinidad and Tobago Police Service have received the ticket books for the mandatory mask wearing policy. Those were received yesterday, so the population can appreciate from today and can prepare themselves from today. If persons are found not wearing their masks in public places, Trinidad and Tobago Police Service will now be issuing tickets to those persons. So they've asked me to just notify you of this. I have been observing over the last week or so, and the number of persons wearing their masks has drastically gone upwards just from my eye observation. The police were telling me yesterday people started to become complacent again and were no longer wearing their masks. Be warned, they now have their ticket books, and you can possibly face that fixed penalty ticket fine of $1,000. And I'm sure nobody wants to have to pay $1,000, where all you have to do is wear your mask, or as the Minister of Health was just saying, your face shield or some covering over your nose, mouth and chin area in accordance with the regulations. The last thing I'd like to say before I hand it back over to the moderator is the threat of litigation and the use of the media. People are free to use the media, people are free to contact the media, because I understand how painful it is. I understand how difficult it is. This is for persons who want to come home. But I just want the population to know that by going to lawyers and litigating and pre-action protocol letters against the Minister of National Security and others to try and jump ahead of the current criteria that is being applied for exemptions is not going to work. Every single one of those cases, I've allowed it. I've passed it over to a legal team that is headed by senior counsel. We've gone to court and we've defended and successfully defended the policy that is in place. We cannot allow persons just by going to lawyers to jump the criteria that we have in place. And the threat of litigation is not going to help your cause. Whilst I understand some persons who may feel desperate and feel that is the route they have to take, it simply is not going to work, because none of those persons have I been influenced by the threat of litigation. I've allowed it to go to court, and in fact it may delay your process, because then the lawyers go to court, and so far the court quite rightly has understood what we're doing is protecting the population, and the criteria that is in place for sick or elderly, those with young children, and the criteria we've been applying to determine the prioritization of persons getting home has been making its way through the court and has been not turned over by the court system. I don't expect it to be. Now with this liberalized exemption policy, I expect the process to pick up a lot quicker, and we are going to do the best, working with the Ministry of Health, to turn around those facilities. I'm also going to be speaking to Caribbean Airlines to try and put on some flights to destinations where we'll be able to get persons back as quickly as possible. Thank you very much, moderator. Candice.
Thank you, Minister Young. As we move into our question and answer segment, a reminder to media representatives, please state your name and the media house that you represent. And also, please no more than 2 brief questions at this time. And we begin with Guardian Media Group.
Hi, good morning. My name is Cindy Gray from PNC3. The first question I wanted to ask, 2 weeks ago, we had a presentation from Dr. Nandram, and he spoke about they're really going to try and speed up the delivery of results. I noticed today that we're still reporting results from a period of a few days, and we haven't gone up to 24-hour testing and results. If we can just get an update on that, I would appreciate that a lot. And we are getting reports from persons, especially elderly persons, who are COVID positive, and they are experiencing an escalation of symptoms at home. And when they try to call the hotline, they're not getting a response. So if we can also get an update on what is the status with the call lines, or what is the correct procedure for persons who are COVID positive and have an escalation of their symptoms at home and require or contact the medical official to see if they require a hospitalization or if they can remain at home. What's the additional guidance? Because we are being told that the hotlines are, they can't access the hotlines and therefore they're unable to get responses.
Thank you very much, Ms. Gray. And we will go to the Chief Medical Officer to respond to these questions, please.
Okay, so in terms of the update on the lab, first of all, we are in the process of getting our final reagents to set up 3 additional labs, which is the lab at the North Central Regional Health Authority Southwest, as well as the MRF, Medical Research Foundation, which has been assisting us with delivery of results over the past. So having those 3 additional labs will give us a capacity in close to about 600 additional tests per day that can be run in the system. So there are 2 things that have driven the results. One, the input, as I described Saturday last week. The input was just merely more than we could have processed in one particular day. So with that increase in capacity, we will expect that in the coming weeks, we should be able to get ahead of that backlog that existed. In terms of the timeline for results, I think we need to be a little realistic in what is happening. So in terms of a test reaching a lab and being processed, what we are aiming for is for when that sample gets to a lab, to the time that the result is generated is a period 24 to 48 hours. That's our target. We have to understand how the sample gets to the lab. So for instance, it may come from a health center, it may come from a hospital. So from the point of time a patient sees a physician, the sample is taken, it then goes via courier, whatever transport measures, going to the Trinidad Public Health Lab. Then the Trinidad Public Health Lab actually takes that sample and would send it either to the Caribbean Public Health Agency, to the University of the West Indies St. Augustine Lab, or the MRFTT Lab. So there's a process in time that occurs there as well. Once those results are run in those requisite labs at a 24 to 48 hour period, then the result is generated, sent back to the Trinidad Public Health Lab. Those results are then put into the system, the IT-based system, sent to the CMOHs. The CMOHs now have to contact the patients directly, and they also send a copy of that result to the health centers or the hospitals from which that swab has emanated. That time period is generally about 5 to 7 days in total, from the time the patient gets the swab to the time the patient actually is able to have a health center receive that result back. So just to give a little realistic view of what we expect to happen in a best case scenario, and when we put those 3 additional labs in place, we expect to be able to achieve that hopefully later on next week or the early part of the week thereafter. In terms of your hotline status, I believe we had put in place the addition of 10 additional physicians to man that hotline, who should be coming on stream very soon. So it will give us a little additional capacity as the hotline pertains to the hotline. But for the positive patients, as we have said, the county medical officers of health have a listing of all positive patients in their jurisdiction. They will be monitoring by phone call twice a day those individuals to ensure there's no de-escalation of their symptoms. If, however, your symptoms do escalate in between those calls, please feel free, as we said before, to either call 811, which is the EHS hotline, and they will take you into any of the facilities, or to go directly to a facility if your symptoms worsen right away. We don't want people to be attempting to call the hotline or awaiting a CMOH call and your symptoms worsen in that intermingling period. We just want you to go in and seek care as urgently as possible to avoid any untoward complications of this disease. Candice?
So CMO, if I might just clarify, because GML raised a very important issue. Yeah. Anyone at home who is not feeling well, who know they are COVID positive, if you can't get onto the hotline, simply call 811 and GMRTT will take you to the appropriate medical facility. Thank you.
Thank you very much for that response. And we move now to AZP News. We're ready to field your questions.
Hi, Harry, AZPnews.com. Mr. Young, I just want to elaborate a little bit in terms of the policy. For example, if you look at America, there are certain states that, would be considered high risk, like Florida, for example. And most of the nationals who who are coming back home, they would pass through Florida. You know, the repatriation flights would usually come through Florida. Are you taking into consideration that, in other words, if someone is in a state that could be considered high risk, how is exactly the policy going to work with that? And are you going to give us a listing of the countries you consider low risk, right, and high risk, etc.? Those are my questions. Thank you.
Thank you very much, Prior. It will never get down to that detail and that level of granularity. You can't say, well, look, you were in a state of say, let's say Kentucky, and you were in a small town, so therefore you're at a lower risk. As I said, what we'll be using is the WHO classification, and it's a country classification. Because persons may, I mean, look at Trinidad, for example. When you look at the map of where the positive COVID cases have been, I have noticed down on the East Coast, you're not seeing a lot of positive cases down on the East Coast. So does that mean a person from Mayaro is that, gets a different classification? The answer is no, we're not doing it that way. We're doing it via the WHO classification. And right now, it's a country classification, and that's what we'll be using. And yes, we will publish out of Ministry of National Security, after consultation with Ministry of Health, the classification of the high and medium risk countries versus the low risk countries. But I'm stating here very, very openly, it's going to be almost a mirror image, if not a complete mirror image, of what WHO has classified countries as. Thank you.
Prior, if I could just, again, support Minister Young. When Grenada reclassified us, just to lend to what Minister Young was saying, if you look at Trinidad and Tobago, different counties have different disease burdens, and the CMO could correct me if I'm wrong, because he was telling me recently the two counties in Trinidad that we are concerned about is County Caroni and County Victoria. Grenada did not say, if you're coming from County Victoria, this is the rule, and if you're coming from Napa, so, it's a country classification. We are not going to get down into granular details of the region of the country, the street, the town, or whatever. CMO, am I right about County Caroni and Victoria?
Yes, amongst others, yeah.
Good, thank you.
Thank you very much. And now 91.9, we are ready for questions from you, please.
Good morning, Vern Extavo, 91.9 FM. Just two questions. We've gotten some complaints from persons in quarantine, CMO, who tested positive and are coming to the end of their quarantine period, but have not been flagged, contacted, or called to have their second test done to confirm them as negative, so that they could also get fit to work, to head back out to work. If you could comment on that situation, let us know what is the procedure for persons who are quarantined but positive. They were, discharged from the quarantine facility as positive patients and went home to further quarantine. And for the Minister of Health, the conversation has been coming up from at least 4 persons contacting us at 91.9 that some employers have been flouting some of the health regulations and putting employees at risk. One particular person said that they hold the employer responsible for not letting people know that they were COVID positive people in their workplace, and they got COVID because the employer did not do what was supposed to be done. What is the Ministry of Health position or government's position on taking any action against employers or monitoring a little bit better employers who have to take necessary precautions for having COVID positive people? Thank you.
Thank you very much. And we go again to Chief Medical Officer to respond to these questions.
Okay, so in terms of your first question, you want to know someone is at a quarantine facility, test positive, so they become a COVID-19 positive patient. As we described about a week ago, there was a change in the policy where we took away the 2 negatives in terms of discharge criteria. So the discharge criteria, just to reiterate what it is now, so for symptomatic positive patients, we are looking at 10 days from the date of onset of your symptoms, plus an additional 3 days where you have absolutely no symptoms, meaning no fevers, no respiratory symptoms, no symptoms at all. And we have added on top of that an additional 7 days. Just to give us, as we have noted in the first phase when we tested individuals, they usually got their first negative at day 6, asymptomatic. So we have added that additional 7 days. We have taken away the diagnostic criteria, and we are using strictly a clinical criteria for discharge. So you won't be getting that negative discharge. However, you will be getting a quarantine order which speaks to the 21 days roughly. And once that period ends, you can be free of, fairly confident that you won't be able to have infectivity occurring beyond that period. For asymptomatic persons, we are using a similar formula, but the 10 days begins at the date of onset of your positive test. We don't add the 3 days asymptomatic because you would have been asymptomatic from the start. We are adding 7 additional days based on what I discussed before. In terms of the prior question related to the public health, what has happened, and across the board in all counties, the Public Health Inspectorate, together with our M&E officers, have been visiting various organizations, private and public, to determine compliance with the level of readiness in terms of our guidelines. And they have said to me, even in St. George Central when I visited yesterday and St. George East, there's a fair degree of compliance. I had a report from the Chief Public Health Inspector which indicated for food premises, for example, there was upwards of 90% compliance in that particular sector of the business community. However, having said that, under the public health ordinance, we don't take to task the employer unless there's something that speaks beyond guidelines but goes directly to the law. So for example, if you have a sewage system that is not functioning well, we can use the ordinance to actually serve your notice and then of course take you to court based on that. So we're asking for persons to abide by the public health guidelines. They are all on our website, making sure that your employees are safe when they come to work, and most importantly, that there's some level of checking prior to coming into work every single day that we can do beyond fever screening alone. There's a checklist of symptomatology that we ask our workers every single day when they come to the office or they come to their business place, if they are ill, and if they are ill, that they stay away. Because we have noted in a number of instances, we have seen spread of this disease in the workplace based on persons coming to work ill. Even in the healthcare system, we had instances of that occurring. So we are asking the employers to be mindful of the guidelines, to adhere to the guidelines, and ensure that your employees do so as well. Candice?
Thank you very much, Chief Medical Officer. And now 98.1, the floor is open for you.
Good morning again to the panel. Stephen Cummings, 98.1 FM. My two questions, one for Minister Dayal Singh and the other for Dr. Parasaram. And I begin with Minister Dayal Singh. Minister, next week is being declared as Global Week for Action on NCDs. The aim is to increase accountability, especially for, by government and policy makers. Now, it comes at a time when the WHO has also seen the pandemic as having underscored the urgency to address several risk factors in a younger population, including persons who are obese and have diabetes, hypertensive, COPD, compromised, to name a few. What is the local national plan going forward at this time on our local NCD's response, which can also be key in treating with COVID-19 cases? And Dr. Parasaram, it is said that corticosteroids can be life-saving for patients in critical need of oxygen and those on ventilators. Is this form of treatment being used currently on patients, and how, if so, how widespread is this in our local context? Thank you.
Thank you, Mr. Cummins, for your very important question. You may recall that as Minister of Health, I went to Cabinet very early in my last 10 years Minister of Health for Cabinet to sign off on an arrangement with the IDB for a $55 million loan to fight NCDs. The strategic objective was at that time, and still is, to reduce the incidence of deaths due to NCDs by 25% by 2025. That was the strategic objective, the strategic intent. To achieve those objectives, we took the following steps. 1, recognizing that we have to treat obesity from the womb to the aged. We are going to be signing off very soon, for the first time in this country, a national policy on testing all women for what is called gestational diabetes. while you are pregnant. 2, we took the decision a few years ago to ban the sale of soft drinks and other sugar-sweetened beverages in schools. That has seen, at my last count, which is a bit dated now, a 25% decrease in the consumption of soft drinks by children in schools. We have urged people to change their lifestyles. We have had the TT Moves program. We are installing, under that $55 million loan, a set of exercise equipment in schools, public places. We have simplified the drug regime for hypertension, moving from multi-pharmacy therapy to monotherapy to make compliance better. And these are just some of the tactics being used to achieve the strategic objective of a reduction in deaths due to NCDs by 25% by 2025. It is calling for a complete culture change, because as a people around the world, we are addicted to sugar. Let's admit it. It's an addiction like anything else. And we have been urging people to switch their eating habits from white flour to whole wheat flour. We are encouraging people to exercise, drink more water, eat more fruits and vegetables. So that is what we are doing. And we don't wait in Trinidad for a week. It's important, but we practice our NCD prevention strategies every single day at the Ministry of Health. But thank you for your very excellent question.
Thank you very much, Minister. And I think CMO will take the second question.
Yes. So there was an article that published in the Journal of American Medicine recently on the 2nd of September, which supports what Mr. Cummings is asking. So it actually has a meta-analysis of 7 randomized control studies that were used to actually show the incidence of death and mortality and morbidity among critically ill patients decreased with the use of systemic steroids in those categories. So we have been in Trinidad using corticosteroids, systemic hydrocortisone and the like for patients with COVID-19 from the beginning. It is not considered a treatment per se. It is considered supportive care for any inflammatory condition which COVID-19 seems to be in certain parts of the body, for example, the respiratory system, as well as the vascular system. It seems to be inflammatory in nature. And we have used steroids and continue to do so for critically ill patients in Trinidad and Tobago. And this study that has come out on the 2nd gives us the additional push to continue to do so in Trinidad and Tobago.
Thank you, CMO. And we go to Minister Young just before we take questions from TV6 next.
Thank you very much, Candice. I shouldn't be surprised, but there are immediately persons asking very mischievous questions with respect to the tickets and the ticket books. So I just wanted to put it to rest immediately. The ticket books, as with all fixed penalty ticket books, are printed by the government printry. So there was no contract awarded or no tender process, etc. So those who wanted to go down that rabbit hole, good luck. But the ticket books were printed, as they always are, by the government printry, and they're now in circulation and distribution for the Trinidad and Tobago Police Service, who I just want to thank for continuing to do a great job. They have been one of the frontline workers and persons doing what they had to do to protect the population. Continue to keep up the good work, TTPS. Thank you. Thank you, Candice.
Thank you, Minister Young. And now TV6.
Hi, good morning, everyone.
Morning.
Quick question to the CMO. The numbers of persons coming in for testing throughout the country, have they been increasing, or are we seeing a decrease in those numbers? And to Minister Young, where can we find the criteria for the listings of the criteria for the exemption for persons seeking exemption? Is there a website that they can go to? And are persons who are applying for exemptions, are they being served on a first come, first served basis? And if not, could you explain how or why?
Thank you very much. CMO, would you go first?
Sure. So basically we are seeing a small decrease in the number of persons being swabbed. I don't have the figures with me for the national community, but I know, for instance, for Southwest RHA, they have said to me recently that they're doing about 150 swabs per day in that county. It would have been much higher than in that part of the country. It would have been upwards of 300 at one point. So there has been a slight decrease that we have noted in persons, number of swabs being done per day.
Before we go to Minister Young, let me just further support what CMO just said. We have installed the Abbott tested PCR machine in Southwest. Training, I believe, is finished. The test kits actually came in before schedule. We got in 8,000 test kits on Tuesday or Wednesday. Those test kits have been deployed to Southwest, North Central, and MRF-TT. The reagents are coming in soon, and once those come in, Southwest, for the first time, consistent with our policy of decentralization of testing, will start their own testing hopefully by next week as supply chains globally open up. So that's a very positive development for Southwest. Thank you.
Thank you very much. To answer the question that was posed to me, the liberalized exemption policy, I've asked for national security to publish it, so that will go out shortly with exactly what was discussed with the Ministry of Health and approved by the Prime Minister. So that will go out shortly and that will set it out. We had stated previously when persons asked, it's not a first come, first served basis. That is only one of the criteria we are applying to the prioritizing of persons who are granted exemptions. So one of the things we look at is, yes, when did persons apply? This morning in discussions with the Permanent Secretary, we're also going to be speaking to immigration when we're looking at names to identify when it was that persons left Trinidad and Tobago as well, to assist in that. But then we also have other categories, for example, the elderly, those who are sick and ill. And what we do is we break it down. Every time the granting of the exemptions, what we do is we break it down. Those with young children, there were persons who went abroad and then ended up having babies, there are families. So we have various categories and we break it down. So it might be 60% in this category, 10%, 30%, and that is how it's being done. So there is an established criteria that has actually gone to court, etc. And this is now going to be pushed into this liberalized exemption policy so we can get our nationals back here as quickly as possible. Those who've so-called jumped on the bandwagon later on, who were not domiciled or resident in Trinidad and Tobago and were living their lives abroad, they are not going to be prioritized. There are also questions being asked about persons whose passports may expire. What I've been doing with persons, Trinidadians whose passports have expired, immigration via the Minister of National Security via immigration can grant exemptions. I'm not letting that be an issue at all. We also have persons who may have had babies abroad and they don't have their Trinidad passport. Again, we will grant the emergency documents for them to travel, etc. Those who may be in other countries and their visas of those countries expired, well, unfortunately, you have to follow the process there. But hopefully with this exemption policy, this liberalized exemption policy that we've described here this morning, that's kicking in straight away, hopefully we'll get people back a lot quicker than before. Thank you.
Thank you very much, Minister. And we move to TTT next.
Good morning, Ian Alleyne, TTT News. I have two questions actually. In terms of the home quarantine or the home recovery for the persons who are on their way to recovery, how successful is that? How is that working out? Are people committed to staying home, or are there reports that people need a little help from the police to stay at home? And two, this question is from one of our many viewers. This person is asking, how does COVID-19 affect the ministry's NCD 2025 goals?
Okay, so I'll take the second question, and CMO will go to the first question. There is no doubt, and I'm not going to varnish this or make it sound that things are honky-dory. COVID-19 has disrupted healthcare systems around the world. Around the world. Trinidad and Tobago being no exception. We have had to adjust the way some of our outpatient clinics operate, but more importantly, we have been urging our patients to continue with their medication, to continue with their exercise routine. I will not be surprised, let me put it that way, I will not be surprised if there is some negative fallout on our NCD plans for 2025 because of COVID-19. I will not be surprised. We have to be realistic. This thing has disrupted life around the world, Trinidad and Tobago being no exception. But we are going to be signing off very soon on the gestational diabetes program, first of its kind in Trinidad and Tobago. I am not going to be deterred by only thinking that the Ministry of Health is about COVID. It's a parallel healthcare system. We are running two systems simultaneously. But we do need the public to step up now and take a little more responsibility for their diabetes, their hypertension, their dialysis, their cancer treatment, watch their weight, and do all the common sense things. Okay, but Ian, I want to really thank you for that question.
Thank you, Minister. And now to CMO.
So the home quarantine so far has been going very well for the majority of persons. Just be reminded that when we get your information as positive, we also share that with the Trinidad and Tobago Police Service. So they are aware of the persons that should be in home quarantine. And if need be, they would call, they would drive by and do what they need to do to enforce the law as it relates to the Quarantine Act. But most importantly, in terms of the home quarantine, what it has allowed us to do is free up the space at Couva Health Facility as well as Cora for moderate and severely ill patients so that the clinicians have the capacity to treat those persons when they come in and they recover to the best of our ability. We do that to the best of our ability to avoid morbidity and mortality, meaning to avoid severe complications of this disease as well as deaths as best as we can. So the policy is driven by that objective. And of course, we don't want persons to break your home quarantine in any form or fashion. We have been using alternative forms of tracking as well through mobile phones to ensure that persons stay and abide by the home quarantine. Thank you, Candace.
Thank you very much. And Express, we're ready for your questions at this time.
Good morning, Hunt Express. Minister Young, some students at UWI Mona campus have reached out asking when there will be flights to Jamaica so they could resume their classes. Can you offer any guidance on this? Thanks.
Yeah, thank you very much for that question. There have been a number of flights. I mean, we've put on, I think it was week before last, we put on 2 flights to Barbados specifically for students. What in this time where there's not a lot of commercial travel taking place across the globe, it really is up to persons to seek and to find ways of travel. The government is not going to be able to provide a travel service where we can get people exactly where they want to go. So what we've been working with at National Security is working with Caribbean Airlines to find safe ways for them to take passengers, and particularly students. The students with the focus to for example, Barbados, and to Florida, to New York, and to Canada, for them then to jump off. So they would have to look for where they are, but Jamaica is one of the areas that we're looking at over the next, I would say, couple weeks to see how we can maybe put on a flight to Jamaica, because we have a number of nationals in Jamaica as well who we want to get home. Thank you.
Thank you very much, Minister. And I believe Express just had one question, so we will go to Wired 868, please.
Hi, good morning. Lasana Library, Wired 868. This morning, we were told about additional 102 positive persons, with 33 already housed at a quarantine facility. Could you explain where those 33 persons came from? And is there any reason why we stopped getting information such as the primary contact, foreign national, and so on, in terms of the positives? And additional question, when someone tests positive, as I understand, the entire household is isolated, but not necessarily swabbed themselves. Are the persons in the households who are not swabbed added to the figure provided by the ministry for persons in home isolation, or does that only refer to positive cases? Thank you.
Thank you, and we go to the Chief Medical Officer to respond.
Right, so as I said before, the 33 persons came out of a group of individuals that have been domiciled together, upwards of about 190 persons. There was an introduction of COVID-19 about 2 weeks ago a week and a half ago into that facility. So out of the 190, 43 persons presented with symptoms. They were immediately taken out of that particular facility and moved to Freedom Hall. They had been swabbed once they came in, and their results would have come in as positive for 33 of those individuals, and the remaining would have been negative. We are in the process of organizing reswabbing of all 150 persons who remain in that particular facility. And based on the results that we get, if we get negatives or positives, they will be disaggregated in terms of movement of persons so that we try to limit the exposure, and of course sanitization will occur if need be as well. In terms of your second question, so you're asking basically, in terms of your household, those persons who are in the household but not positive won't be added to the positive figure. They will be primary contacts of the positive case, so they won't be added. In terms of our swabbing policy, household contacts of a case, once they develop symptoms, they will be swabbed immediately, post-dating the symptoms of the initial person. If you remain asymptomatic, in keeping with WHO's policy as well, there's not a necessity to swab those individuals. They will be kept for the full duration of the quarantine and then released once no symptoms and signs present us. So they will be swabbed only if they present signs and symptoms at this point. Thank you, Candice.
Thank you very much, CMO. And we go now to the Minister of National Security before we take questions from Newsday.
Well, thank you very much, Candice. I thought we were wrapping up. If you would just indulge me, for those who have been following us on this morning's very important press conference, I've just been notified that TKR's innings ended at 175 for 5. Thanks, Candice.
That's a COVID update courtesy to the Minister of National Security.
Thank you very much, Minister Young. And Newsday, you have the honor of the final questions this morning.
Hi, good morning. Janelle Souza from Newsday.
Morning, Janelle.
The Commissioner of Police made a statement that people with mental illness and health conditions should have their medical letters on them when they, if the police comes to ask them about the face masks and so forth. What should people do with conditions to get exemptions? Be part of that. Is there some kind of standard for face coverings? Because we've been getting reports of people using J-cloths and things like that for face coverings. And the second part is, now that we've had some more deaths, are the trends the same in terms of age, gender, comorbidities? Are those comorbidities mostly NCDs and so forth?
Thank you very much, CMO. I know we have a few extra questions there. I'll respond for us, please.
So in terms of your medical, so persons that as Minister would have read out the regulation, if you can't wear a mask, you can't wear a shield that covers your nose, face, and mouth, and you can't wear a face covering, all three, and there's a medical reasons for such, then of course you visit your medical physician, and they will have to issue a letter saying that you can't wear any of the three, and you should keep that on your person in the event that you're caught in a public space without wearing those pieces of covering, so that at least you have the letter. So the exemption letter is not an exemption letter per se, it's a letter from your physician indicating the reasons why you can't wear any of those articles. In terms of your question, again, yes, we're seeing most of the deaths that have occurred in Trinidad are aligning to the international trend of persons having comorbidities. Mainly we see diabetes, we see hypertension, we see some oncology-related illnesses, cancer, and the like. So it has been aligning, and it has been aligning in terms of age as well. A number of the deaths occurring in persons over 60. The majority of deaths occurring in persons over 60, a lot of them occurring over 70 and 80 as well. So thank you, Candice.
Thank you, everyone, for joining us for today's media conference. We really do appreciate that you take the time to join us every week. And remember, we're all in this together. Be safe, wear your mask, and enjoy the rest of your day.